Last night we saw the return of Luka Doncic and his infamous ever-bleeding left knee. In this video we'll take a look at what in the world I think could actually be going on here, and plus we'll touch on some other big NBA playoff injury storylines like Jayson Tatum, Morant, and touch on some stuff with Kyrie Irving. Welcome back everybody, I'm Dr. Brian Sutterer, and the goal in this channel is to teach more about the medical side of the sports world. So we're gonna play a little bit of detective here, and first off, see if we can figure out when all this started, what's been going on, is this anything to be worried about with Luka's recurrent left knee? This was an image from early in the first quarter last night against the Timberwolves. We can see the same spot on the front lateral outer part of Luka's left knee where we see that same area of bleeding occur. If we ask Grok for a little bit of help here on how long this has been going on, it seems like as early as 2023, there's been these instances of clips circulating on social media of Luka having this bloody left compression sleeve all in that same area. I believe this one is from May of 2024. Again, we see that same location, that little circular spot of some red blood on the front outer part of his left knee. Different game here against the Rockets. Again, that same spot, left front of his knee. We see a little bit on the right side as well. And so there's clearly been multiple instances of the exact same location bleeding. What's interesting here is this is near the location where you could potentially approach the knee to do an injection or to drain fluid off the knee. And I think this image in particular really helps us understand the anatomic landmarks for where this is anatomically on the knee. We can see here, this is going to be the kneecap, the patella. We're then going to see this little protuberance, this bony prominence, that's going to be the tibial tuberosity where the patellar tendon inserts onto the shin bone. And then this is going to be right around his joint line of his knee. Next, we'll try to correlate this to the actual anatomic model and talk about the different theories before getting to the rest of our playoff stories. But first, I want to take a quick break for a word from the sponsor of today's video. Today's video is sponsored by Aviron, a company that's going to help you row, run, and ride your way to the most fun you've ever had while working out. Aviron's rower features a comfortable but compact and easy to store design. I love all the different games and interactive features within this rower because it brings a new fun angle to working out that really does kind of trick your brain to help keep you motivated and coming back for more to really be better each time. They have interactive classes and coaching, your favorite streaming apps to watch your shows while you're working out, and just countless things to keep you coming back and motivated and engaged with your workout. Right now, Aviron is offering their best prices, and if you click the link down in the description or scan the QR code and use my promo code BrianMD, you're gonna get an additional $50 off. And aside from the amazing features, this is just a great rower. I love the addition of strength and cardio training that I kind of feel like I get 2 for 1 when I'm rowing. I don't have that impact of being on the treadmill. It's a nice, very smooth and comfortable glide with the rower and just an all-around great machine that I love to use to help meet my fitness goals. So make your workouts more fun and engaging by checking out Aviron's Strong Rower as well as their bike and treadmill today. Thank you again to Aviron for sponsoring today's video. Again, $50 off, code BrianMD. Click the link down below or scan the code. Remembering that image of the front outer portion of Luka's knee, the region that we're going to be talking about is right about here. Our structures, this is going to be the patellar tendon. We're then going to have the joint capsule, which is the lining, the outer surrounding of the joint. So if we hide that, now you can start to see what lives right below that joint capsule. That's going to be the actual joint space. So one approach for whenever you're doing a landmark guided injection or aspiration in the knee is to go just lateral or to the outside of the patellar tendon in this little soft spot here in the front portion of the joint. You can approach that from the medial side, meaning the inner part of the knee, or you can approach it from the lateral side of the knee. And you're literally trying to feel for the soft spot in the front of the knee, just next to the patellar tendon to get the needle into this joint space right in here. So yeah, one possibility is certainly that this is the result of repeated needle sticks to drain or inject his knee. But when we think about the theory of like why that would be done, to me, that doesn't make sense, and I don't think is what's happening here. Because number one, that's not something that would have been happening for multiple occasions over multiple years without us hearing something about it. We've never heard anything, not even like rumors in the news about Luka receiving injections in his left knee joint. Also, number two, if you were going to do an injection in this area or drain fluid out of this area, you're going to cover it with a Band-Aid, especially when somebody's about to go participate in a sweaty sport. You're not going to leave it exposed for blood to just ooze out. And if it does bleed a little bit, which is normal, it's not going to continue to bleed 15, 30 minutes later after you've already done the injection. If anything, it's going to bleed right away for a minute or two. You're going to hold compression. The blood is going to clot off, and then it's going to stop. You're not going to see blood accumulate 30 minutes later if you've done an injection in that area. And similarly for draining fluid out of the knee. You're not going to see bleeding 20, 30 minutes down the road. You're going to stop the bleeding right away. You're going to cover it up really well. And so I don't think that, even though this is a location where you can perform a landmark, meaning palpation guided injection or drainage aspiration of the knee, I don't think this is recurrent needle injections, pain medicines in his joint. If you look at the rest of our anatomy here, you'll see that there are a lot of bony prominences at that top portion of the tibia. We call this the tibial plateau, and there's really no muscles around this area. There's no significant padding around this area. It's very exposed to shear injuries from trauma. And yes, the way that Luka plays, I think he is just prone to a playing style that causes this area to get repetitively torn, cut, injured, and then develop the bleeding, because they're not going to take him back in the locker room in the middle of the game and try and pull him out to do any cleaning this up. In last night's game, it looked like he actually came back in the second half and had cleaner compression garments. So they probably put some dressing over it. They covered it up. They kept it clean and dry. But don't be surprised if we see this come back in the future. So of all these theories, I think what's most likely is that he is just simply having repeat trauma to that same area. I don't think there's any conspiracy that he's been getting injections or they're draining his knee or pain medicine shots, anything like that, because we would have heard something over the last 3 years, and you wouldn't expect any continual bleeding that far out into the game. Next, let's talk about Jayson Tatum. This is something that I would not be overly concerned about. We saw the play in game 1 against the Magic. Tatum here, as he goes down to land, we call this a foosh, fall on an outstretched hand. He goes down, he lands on that right wrist. His wrist goes into a sudden extended position right here. And what that's going to do is it's going to put all of his weight, all that impact up through his wrist, up through his forearm, and potentially cause injuries. We've seen that Tatum got an MRI. Of course, x-rays were negative after the game, and we've gotten, and I think, a pretty positive update on the results of the MRI. The official report from the Celtics was that he has a right distal radius bone bruise and is doubtful. I'm recording this at about 3 o'clock on Wednesday, so I have not yet seen what his status is for tonight, but this reporting does not concern me. If there was, say, an unusual fracture, a fall on an outstretched hand, a scaphoid fracture, a specific bone in your wrist, is a very possible injury that x-rays can miss right away. But an MRI is the most sensitive way to pick that up. So if there was something like a scaphoid fracture, the MRI would have seen it. Similarly, if there was something like a bad ligament tendon injury, the MRI would have picked that up as well. The fact that Tatum is listed as doubtful and not ruled out is very positive. If they saw something on the MRI that was dangerous, couldn't compete through, couldn't play through, etc., he would be listed as out. Doubtful means that it is safe for him to play if his pain and function were well controlled. So this is very good. I would not be surprised if he maybe misses today just to have a little bit more time of rest, but I would fully expect him to be back this playoffs. And unless he lands, re-injures us again, I don't think this is anything that Celtics fans need to be worried about. So again, the fact that he's listed doubtful is very reassuring. If the MRI would have shown something bad, they would not be giving him a chance to play. They would have said, no, you need to rest. We need to treat this. So potential down the road, but in and of itself, not anything concerning, thankfully. The other things I want to touch on here to finish up are in regards to previous injuries and just how things have been reported in the media. As you guys know, if you follow me on social media, I have a really big annoyance with the way that things medically get reported. I think it's confusing. There's a lot of lack of clarity. And this reporting with Ja Morant was a perfect example. We saw the report on April 18th from Shams Charania that basically he said there was, quote, no structural damage in the ankle, but then followed it up to say that Ja had a severe ankle sprain. Those two things contradict one another. I understand the intent. They're trying to imply that there is probably nothing long-term concerning, but by definition, a severe ankle sprain is a severe injury, tear. A sprain is a tear. It's a severe tear to the ligaments of the ankle. Otherwise, there would be no severe ankle sprain. So you can't have no structural damage, but also have severe sprain and structural damage. And this type of stuff is what bothers me. I don't think it's intentional, but it is a little bit deceptive. When you say that there is no structural damage, that gives this impression that nothing is wrong. But then to follow it up with a severe ankle sprain statement, clearly there is something wrong. Now, just because Ja has a severe ankle sprain doesn't mean that it's dangerous for him to play. They've been giving him, it sounds like, lidocaine numbing medicine injections before the game to allow him to play. I think that's safe. I think that's a reasonable conversation to have with an athlete in this circumstance where it's round one of the playoffs. But I wish that reporters had a little bit more sense to question and say, wait a minute, how can there be no structural damage but also a severe sprain? Because a sprain is a tear, a severe sprain is a severe tear, and those ligaments are structures of the ankle. So when you see reporting like this, question it, ask if it makes sense. This is a clear example of where this does not make sense. And then the final thing I want to touch on is with Kyrie Irving and the reporting about his ACL. Of course, we've seen a lot of issues with how the Mavs have been handling things with medical stuff, and the latest reporting about Kyrie's return from his ACL tear is equally concerning. Another report from Shams here saying that the goal and the expectation, I should say, is that Kyrie will be back by January. This would put his return from an ACL reconstruction at less than 8 months, which is far quicker than the average return time for an ACL tear. Kyrie had only been like basically a week or two out of surgery, and they're already putting this expectation that he's going to have a quicker than normal return time. He very well might, and people have shown me examples, right, of course, of Adrian Peterson, other guys in the NBA who have had quicker return times to play, but you cannot use individual cases to make a blanket statement about somebody's recovery when you're this close to surgery. Now, if we hear something in, let's say, September, October, that suggests that Kyrie will be back December, January, then I would believe it. Then, because we know how his rehab has been progressing, we know how his function is doing, we can have that reasonable expectation. But to me, this is trying to overpromise to your fan base and put too high of expectations on your star player by this early saying he's going to have an accelerated rehab plan. This is not normal. If I were in charge of the medical staff, I would tell him that 9 to 12 months is the average. We'll do everything we can to get him back as quickly and safely as possible. Plan on not having him back until after the All-Star break, and plan on him not being at his previous level until the following season. But if I said that, I would not be working for the medical staff, because they want to hear the best. They want everything optimistic. They want everything push, push, push. And that's not the realistic reality of this. It puts unfair expectations on Kyrie. It's sooner than the average recovery time frame. And so if he does get back, great, bonus, awesome. But don't put this expectation out into the ether that the fans are going to expect to see him back by December. Kyrie needs to be back by December, because that sets an unfair precedent that he shouldn't have to live up to. So that's it for the video, everybody. It was good to get some of this stuff off. It's been some interesting NBA injury reporting, and hopefully this is the last you have to hear from me from this NBA playoffs. Let me know any questions or comments down below, and until next time, we'll see you later. Bye.